It's time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips.
This week, researchers announced two major breakthroughs in HIV treatment. First up, the New England Journal of Medicine reported a promising new therapy. John?
Anthony, for decades, doctors have known that a tiny number of people infected with the HIV virus never come down with the symptoms of AIDS. They seem to be immune. The new experiment was based on that medical mystery.
53-year-old Jay Johnson has been living with HIV for more than 2 decades. He takes medication twice a day to keep the virus from developing into AIDS.
It's always in the back of my mind that this medical regimen that I'm on could stop working. It could potentially cause me to lose the battle.
In 2010, Johnson was one of 12 patients to undergo an experimental treatment for HIV using gene therapy. Dr. Pablo Tebas helped run the clinical trial at the University of Pennsylvania.
Our goal is to create an immune system that is resistant to HIV, that HIV cannot infect.
HIV enters and infects an immune cell by binding to a molecule called CCR5 on the cell surface. 1% of people lack this molecule and are naturally resistant to HIV because the virus is locked out of the cell. Dr. Tebas and his colleagues extracted immune cells from the trial patients, then disabled the gene for this molecule. The cells were re-injected into the patients to try to create resistance to HIV.
We proved the concept that you can modify the cells, reinfuse them back into the patients safely, and that they live longer in the presence of HIV.
As part of the study, 6 of the patients temporarily stopped taking their medication. In 4 cases, the levels of HIV decreased. In one of those patients, the virus was reduced to undetectable levels. More than 3 years later, those modified cells continue to circulate in Johnson's body, and he continues to feel fine.
It makes me want to shout out to the world that, there could be an end to this.
This is amazing, John. Does this mean the patients can stop taking their medication?
It doesn't yet. It is astounding research. But remember, in this study, they stopped the medicines for about 12 weeks, and then they went back on it. And the next step is going to be to stop it for 16 weeks, perhaps longer, do more patients, and technically make it a little bit better.
I have to ask you, because I remember about a year ago, there was a baby who people said they had cured HIV from, I should say. And then this week, we heard a similar story, another baby. Is it possible that there is a cure now?
They're not saying cure yet, but it is fascinating. A year ago, that baby was in Mississippi, and it was really quite astounding because a mother came in with HIV and the baby was infected. And the pediatrician, Dr. Hannah Gay, took a very bold step. She said, instead of doing what we normally do, which is just to give 1 or 2 drugs as prophylaxis to prevent HIV, she treated it with full-blown 3 drugs, high dose, as if the baby had HIV. And the baby went away, was lost to follow-up, and came back with having stopped the medicines, and lo and behold, had no evidence of HIV. So people had some questions, maybe the baby never really had HIV, and now this second baby came in California, same kind of story, but is still on the medicines at 9 months. So we don't know if the baby goes off the medicines, will the HIV virus be there or not.
Also this week, a report in the journal Neurology says that deaths from Alzheimer's disease may be far higher than officially reported. The CDC puts the death toll from Alzheimer's at about 85,000 people each year. That makes it the 6th leading cause of death in the U.S. But the new report says the real number may actually be closer to 500,000 deaths. Holly, those are 2 very different numbers.
Very much so. It really comes down to sort of an interesting technicality. Death certificates record the immediate cause of death, essentially what caused your heart to stop beating in that moment. They don't necessarily record what led up to that cause of death. So for instance, an Alzheimer's patient, their death certificate might read pneumonia, which is accurate, but it won't acknowledge that Alzheimer's disease actually led to them having pneumonia in the first place.
Holly, what do you think this is likely to mean in terms of attention and resources directed at Alzheimer's?
Well, hopefully this will be a good thing. So if these numbers are confirmed and stick, Alzheimer's will go from the 6th leading cause of death to the 3rd, which, really it's good for us to have accurate numbers about what's affecting the population so we can make better health policy. And frankly, Alzheimer's research could use more funding.
During awards season in Hollywood this year, we all saw pictures of celebrities smoking e-cigarettes. The battery-powered device allows users to inhale nicotine through vapor without tobacco smoke. But on Tuesday, the Los Angeles City Council announced a ban on e-cigarettes in most public places. E-cigarettes are not regulated by the FDA, and anti-smoking advocates say their long-term safety is not known. New York City and Chicago have put similar bans in place.
Also this week, there was news about the health consequences of losing your temper. Researchers at Beth Israel Deaconess Medical Center in Boston say there's an almost five-fold increase in the risk of a heart attack within 2 hours of an angry outburst. John, we all know about angry outbursts, but what exactly did this report say?
Well, it's interesting. It kind of makes sense, right? When you get angry, your adrenaline goes up, your hormones go up, inflammation may go up, your blood pressure, pulse rise, and your arteries can constrict. You can have a heart attack. So they went and looked over the literature and said, was there an association? There was this strong link. But before people get freaked out about blowing a gasket, every time they get angry, it was interesting because if you lose your temper, say, once a month, and you're at low risk for heart disease, really the odds that you're going to have a cardiovascular event very low. On the other hand, as your underlying risk of heart disease goes up, and as you have more and more episodes per day or per month, then your risk goes up. So you do want to try to cool it a little bit.
Well, so Holly, if you are at risk for heart problems, what do you do to keep your anger in check?
Anthony, the 10-second timeout isn't just for kids. I'm sure my daughters are at home. I hope they're watching now because they'll be so happy to know that. But really breathing techniques can make a huge difference. 5 deep breaths in and out over the course of a minute has been shown to lower your heart rate, and maybe that'll kind of defervesce that anger.
All right. Finally, this week, we hear a lot about the negative effects of sitting still all day long. Now, here's another reason to get moving. A study from the University of Minnesota says workers who use treadmill desks are not only healthier, they're more productive. So how do these things actually work?
It's basically, the treadmill desk is pretty much what it sounds like. You've got a treadmill and you have a desk attached with your phone, your computer, your papers. The one caveat is that you're not really working out here. The treadmills are capped to go no faster than 2 miles an hour, which is really just a very slow pace. But the difference that you see in productivity and attention just comes from the fact that you're actually moving, not just sitting still.
It's very George Jetson.
I want to put one in my office. I don't know how the patients will.
I couldn't believe 10% increase in productivity. I feel like you have to get used to this, though, for a little bit. First start.
I think I'm old-fashioned here. My mother used to go out and play, get some fresh air, and I hope this doesn't replace people actually
really moving.
Really moving, yeah.
Dr. Sean LaPook, Dr. Holly Phillips, thank you both very much.
Great to be here.